I wanted to ask about fourth doses. A number of provinces are expanding eligibility to that, but some are also still suggesting that not everyone needs to take that step. Do you have any recommendations, Dr. Njoo, on how people should approach a fourth dose?
Well, thank you very much for that question. What I would say is that, we've said this many times, is that, Canada is such a large country and the epidemiology from one coast to another coast varies. And so what I think you're seeing is that the provinces obviously have a better handle in terms of what's actually happening on the ground with their quote, local epidemiology, be it at provincial level or even, at a city level, are in the best position to know what the sort of the state is in terms of circulating virus and what the risks are for individuals. What I would say is that generally, as I've mentioned before, I think everyone would be agreed that based on the science that everyone is aware of, that getting 3 doses to everyone who's eligible, I think is the key. There's still obviously some work to do, but we're doing quite well. So let's push on the 3rd doses. What we've also seen from the science is that certainly those at highest risk of severe consequences, let's say the elderly or people who are immunocompromised, especially if, let's say, the time that's lapsed since their last dose, be it a booster or even the primary series, has been more than 6 months, and certainly it's a good time to get that additional dose to protect. Obviously, depending on your personal risk factors, what kind of activities you might be undertaking, and obviously, with other recommendations from local officials. So that I think would be the general sort of approach. But certainly, I don't think there's a one size fits all, and I think the most important thing is for individuals to listen to local public health authorities.
Yeah,
I'm not
maybe
sure,
I'll ask.
Dr. Tunis, I'm not sure if you'd have maybe any additional points.
No, I think that's a very complete response.
Maybe I'll ask my follow up in a slightly different way. Is there a downside to people who aren't in any of those targeted older age groups or immunocompromised? Is there a downside to getting a 4th dose, even if all they really want it for is an extra level of security? I know Canada has plenty of doses available.
It's Dr. Njoo. I think there's probably a lot of opinions out there, even within the scientific community. I would say that if someone were to get a 4th dose, certainly I think it's recognized from what we know from the science that it would be a sort of a temporary or for whatever period of time a boost in terms of the antibodies, but that would wane with time. And what I think is also, I think in many ways, adding to the complexity of the issue is that many individuals have also been infected with COVID-19, the Omicron wave, et cetera. And so we also know that, having a sort of what we call natural infection also confers a certain level of immunity for a certain amount of time. So with all that in play, in terms of being a sort of a protected immunity solely from vaccines, or what we might call hybrid immunity, a combination of having a certain number of doses of vaccine as well as maybe being infected with COVID-19, how that plays in terms of someone's thinking about whether they could or should get a 4th dose. I think if they're in that position, they've already had the 3 doses and maybe they've even been infected. I say, hey, you're doing quite well, and let's maybe put the push on for those individuals who haven't had their 3rd dose of vaccine. The only other point I would make is that why we keep stressing about the 3 doses is that from what the science has shown us is that certainly with vaccination, it's a more controlled way of getting your immunity up as opposed to quote relying on natural infection. We know that people have been sometimes even reinfected, a number of times, and there's some early evidence, and we're certainly tracking that in terms of some of the long-term consequences, long COVID, and so on. And certainly, I think it's better to get vaccinated and depend on the vaccines for your immunity rather than sort of getting multiple infections because there's certainly some evidence to show that there may be some longer-term consequences.